Medical, surgical, cardiovascular systems. Now we're going to be talking about aneurysms. So the basic etiology is an abnormal dilation of the arterial wall caused by localized weakness, stretching in the medial layer of the wall of the artery. There are three basic types of aneurysms, not the locations, but just how the blood vessels dilate the blood vessel walls. You have saccular types develop as a sac on one side of the artery. We have fusiform, where you have dilation of the entire circumference of the artery. And you have the dissecting aneurysms, which happen when one of the arterial walls becomes weakened and blood accumulates within the arterial wall and causes a tear due to hypertension. Men are more prone to aneurysms compared to women. And you also must know what the abdominal aortic aneurysm is, or the AAA, because it's unfortunately very common and must be identified by the nursing student. The biggest concern of aneurysms is its rupture. So rupture of the aneurysm is the main complication and may lead to death due to hemorrhage and eventually hypovolemic shock. So some clinical manifestations. Well, initially, it depends on the location and the size of the aneurysm, but there may be no clinical manifestations until the ballooning of the aneurysm begins to compress on other structures or organs. So usually it's about pain. So typically, when there are symptoms, the patient will manifest a bruit over the area where the aneurysm is found. For AAAs, the patient will feel a pulsating mass in the abdomen accompanied by back or flank pain. Patient will usually manifest hypertension, which is what causes aneurysms in the first place, unless you have some genetic issues or some anatomical issues where the wall of the blood vessel is weak. Blood pressure might not be elevated if rupture of the aneurysm has occurred, so just keep in mind to always look for indications of systemic hypovolemia as well. Some diagnostic tests include ultrasound Doppler, CTA or computed tomography angiography, MRA, magnetic resonance angiography. And again, angiography is when we inject the contrast medium into the blood vessel and we take some diagnostic imaging so we can assess the physical quality of that structure, or in this case, the blood vessel. We have digital subtraction angiography, or DSA. And again, we inject the contrast medium into the blood vessels, followed by an X-ray. And then the computer software limits the focus on the background, and it focuses more on the actual blood vessels that may be dilated in an aneurysm. Medical management includes controlling hypertension. That's the first line of defense against prevention of an aneurysm or prevention of the rupture of an aneurysm, because hypertension is a contributing factor to these developing. Patient will also be given stool softeners that may be prescribed in order to prevent straining, which could lead to an aneurysm formation or even a rupture if the client has one already. Surgical repair may be required. Post-op precautions aimed at decreasing ICP and intra-abdominal pressure if that's where the aneurysms were located. Dietary management includes low sodium, low fat diet, and control of blood pressure, of course, is the utmost importance, and that's where we limit the sodium and the fat in the diet. Nursing measures. Well, monitor for constipation, indication of hypertension, and indications of hypertension. Monitor for hypovolemic shock in case of suspected rupture. Assess for changes of mass pulsation, because if it ruptures, pulsation will cease. And limit the head of the bed to 45 degrees. Keep in mind that people with aneurysms will have something called aneurysmal clips placed, so they can limit the blood flow to the area where the aneurysm is located. Medical management also sometimes includes surgical procedures where they remove they clip away the actual aneurysm and they replace the wall of the blood vessel with some type of meshwork to help it heal. The aneurysmal clips, they limit the blood flow to that area, and remember that they are magnetic, so they're metallic, so no MRIs when somebody has aneurysmal clips as well.